We pride ourselves on our integrated, person-centred approach that aims to meet the person's need in the way that is best and least intrusive for them. Our services are fully integrated across health and social care organisations and include services such as community nursing, occupational therapy and physiotherapy, social care provision and pharmacy.
With increased demands on community teams of patients with higher complexity and a rise in elderly population and the national picture of a nursing shortage, we had to think creatively in Exeter to respond to this challenge. The Community Nursing Centre is a service that offers patients who are mobile and can travel an alternative venue for their care. This releases capacity for the home visiting community nursing teams to respond to patients with more complex needs.
I first came to the Whipton Clinic probably last October, I think it was, when I had a wound which needed daily dressing following an operation, and then a couple of months afterwards I started chemotherapy and I had a PICC line put in, and so since then I've had the PICC line flushed every week and blood tests taken as well. And so in many ways the nurses have looked after me in a very much an overall way, because when there have been other issues then I've been able to discuss those as well. And so we have felt very much that the nurses have not only looked after the parts that they were looking at, the operation site and the PICC line, but my wife and I have both felt that they've taken care of us as an individual and as a couple. So I've had some very good care at the centre. The team here are an excellent team, they're very well led, some very capable nurses with some really good skills and very human as well. In fact, we've really enjoyed coming to the centre because it's become part of our life and it's a bit like an extended family in many ways.
I had a very large chronic ulcer and it was taking an awful long time and didn't seem to be healing. And I jumped at the chance to come because the continuity and frequency of the dressings, which is so important, and also the continuity of the staff, because they can see with the various pictures they took and the measuring, you could see the ulcer getting smaller and the improvement taking place all the time. And it was well worth all the travelling. It didn't worry about that because of the end result, because now it's healed up. It's absolutely marvellous.
We work with patients and families in an integrated way, not only with our own services, but with our primary care colleagues around our GP populations throughout the city. Our strength is our unique offer that is an integrated service focusing on enabling the individual to be as independent as possible wherever they are in their life journey within the context of health and social care delivery.